If you could work with a client who earns a high income, has complex financial needs, and values expert guidance, would you take that opportunity? Today, we're talking about why high-performing financial advisors focus on doctors and how it could transform your practice. Welcome to the Engaging Doctors podcast. If you're a financial advisor who wants to accelerate your business growth by attracting, engaging, and serving more doctor clients, you are in the right place. I'm Dr. Vicki Rachner, your host. I'm a retired surgeon who spent the past 15 years helping financial advisors crack the physician code and reach the doctors who want and need their help. In this episode, you'll discover the financial power in the medical market, why doctors need financial advisors, and how serving doctors can create long-term business stability for you. So let's get started. Well, why might you be interested in working with doctors? The answer is simple. It's Sutton's Law. When Willie Sutton was asked, "Why do you rob banks?" he said, "That's where the money is." You've heard the riches are in the niches, and the medical market is the richest niche. So let's consider the financial power of the medical market. First, there's the sheer size of the medical market. U.S. healthcare spending exceeds $4.5 trillion, making it one of the largest sectors in our economy. Over 1.1 million physicians practice in the U.S. Add to that hundreds of thousands of dentists, medical executives, and ancillary healthcare professionals. Second, consider the high income potential of doctors. According to the U.S. Department of Labor Statistics, 10 out of the top 10 earners in the U.S. call themselves doctor. The average physician earns between $250,000 and $500,000 per year, with many specialists earning well over $1 million annually. Even early career physicians earn more than many professionals in other industries. And today, about half of practicing physicians have entered what I call financial menopause. They're 55 years or older, considering the transition from their productive earning years to retirement. Third, consider the potential of physicians and dentists to accumulate wealth. With proper financial guidance, physicians can amass significant wealth, but many fail to do so because of lack of financial leadership. Fourth, healthcare is recession-proof. And fifth, healthcare will never be outsourced. It's an industry here for the long run. Now, let's consider why doctors need financial advisors. In short, today physicians and dentists have financial pain and they need help. Before the pandemic struck, only about half of doctors were working with professional financial advisors. And when do-it-yourself physicians were asked why not, the number one answer was, "I haven't found somebody I can trust." In 2019, about half of doctors were behind in retirement planning. Not surprisingly, the half working with professional financial advisors were more likely to be on track. Now, doctors were counting on their high earning years to catch up. But then the pandemic struck. I remember one day walking my dog at a neighborhood lake. A windstorm had blown through the night before, removing a dock from its mooring. The city engineer was there and I asked, "Well, how are you going to fix this?" He said, "I don't know. We've never been here before." And this is a perfect metaphor for the impact of the pandemic on physicians' financial lives. Do you remember the early months of the pandemic? We were concerned about whether we would have enough ventilators to treat all of the COVID patients. Well, every time I operated on a patient, she was on a ventilator. So hospitals throughout the country decided that they would postpone the elective cases so that all of the ventilator resources could be focused on the COVID cases. Now, these elective cases that were postponed are the engines that drive profitability of hospitals and practices and physicians. You're a native in the land of business, so you're used to business downturns. However, no doctor ever imagined a future in which their incomes would do anything but go up year after year. I was blown away when I was invited to a webinar hosted by the American College of Surgeons entitled Survival Strategies for the COVID World. And this was very basic information, like how to do a budget or what to do before consider filing for bankruptcy. Well, there was the celebratory banging on the pots as an expression of gratitude for the healthcare professionals during the pandemic. Every year of the pandemic, doctors' Medicare compensation has gone down year after year. Yet, the cost of delivering medical care continued to rise. Further, we're witnessing something new. Private equity is purchasing practices. Now, we've seen consolidation in healthcare for 30 years. Hospitals purchase practices. Bigger hospitals purchase smaller hospitals. But really, this is the first time we've seen private equity entering as a major player. And today, private equity owns more practices than hospitals do. A plastic surgeon told me about the hostile takeover of her private practice. The business model of private equity prioritizes short-term profits over long-term outcomes. For example, a hospital decided to save money by sending the office staff home at 4. This is an example of a penny-wise and pound-foolish management choice that erodes doctors' career satisfaction. Not surprisingly, we're seeing a spike in doctor burnout. Pre-pandemic, about 40% of doctors reported being burned out. And back then, it was described as an epidemic. Burnout rates soared to 70% during the pandemic. When burned out doctors were asked, "What do you need to turn around your burnout?" the most common answer was, "More money." And in the eyes of physicians, that meant seeing more patients, which meant that they were moving further from the work-life balance that would also contribute to their burnout recovery. The most frequently asked questions I hear from doctors' lips these days is, how do I move up retirement? So you can see that there is a huge group of high-earning professionals who want and need your help. Now, let's consider how working with doctors can transform your financial practice. I'm going to say something that you might find contrarian. The natural behavior of physicians makes it easier, not harder, to build a doctor-friendly practice. Doctors naturally share resources with each other. If we find a medical intervention that improves health, we want to share it. So too, we share other resources. So, for example, here's how I found my first financial advisor. I got a big check. I went to my buddy, Bob, and I said, "Bob, I've got a big check. What do I do?" He said, "Vicki, you need a financial advisor. Here, go and see my guy. He does a good job for me. My wife says that she does a good job for her nonprofit. So great. I have a lot of trust in Bob. Bob was recommending this guy. So as far as I was concerned, I'd already found my financial advisor, even before I spoke with him on the phone. I had helped one of my financial advisor clients secure a speaking slot with a group of residents. I suggested that he invite the retired chief of surgery, who was a family friend, to introduce him. After the talk, the three of us went to the cafeteria to have a cup of coffee and catch up. In the midst of our conversation, the surgeon got out his laptop and started typing. My client and I just looked at each other a little confused about why this man decided to catch up on his emails at that time. But then we found out he was writing the heads of other training programs, suggesting that they invite this advisor to their institution to give the same talk. Now, just to be clear, we didn't ask him to do this. This surgeon saw a helpful resource, and his natural propensity was just to spread the word. Now, compare that to my own experience coaching financial advisors. I regularly have financial advisor clients approaching me and telling me how my Cracking the Physician Code course or my coaching transformed the results that they got. And inevitably, I will say, thank you. I am so grateful to hear that. I'm committed to improving the condition of physicians. And when you're successful, that means that more doctors in your community are successful. So listen, if you know any other financial advisors who want to work with more doctors, please feel welcome to get them into this community so they have access to these resources. Several financial advisors have said the same words. Why would I do that? You're my secret weapon. Why would I give away my competitive advantage? So, when you do a good job for doctors, they will talk about you in the doctor's dining room and in the surgeon's lounge. Your end game is to become the go-to guy or go-to gal among targeted groups of doctors who network together. Then you've achieved escape velocity, and the natural behavior of doctors supports this kind of growth and evolution. Next, doctors are loyal clients. If you do a good job, you'll have that physician client for life. When you work with ultra-high net worth clients, client retention is a much bigger challenge than client acquisition. For doctors, you turn that upside down. The barrier to entry in the medical market is higher. But if you know how to talk so doctors will listen, this high barrier keeps your less skilled competition out. And now you're rewarded on the other side with a client for life. Next, doctors value expertise and pay for a quality service. Doctors are used to hiring experts, specialists like attorneys and consultants. They're willing to pay for value-added services like tax planning, asset management, and advanced wealth management strategies. So serving doctor clients can make your business more predictable. This is a recession-proof industry, and doctors have predictable cash flows, making them reliable clients. So there is a huge opportunity in the medical market. Why then do so many financial advisors call me every day describing their challenges breaking into the medical market? The short answer is this: the world of business operates under different rules than the world of medicine. Taking actions guided by this critical principle makes the difference between struggling and thriving in the medical market. To illustrate, let me tell you a story. I live in Seattle, and last night we had a snowfall. So in my neighborhood, the snow looked like the decorative powdered sugar dusted over a cake. It was really a beautiful sight. And today, school is delayed or canceled in Seattle. As someone who grew up in Minneapolis, I always found Seattle school snow day rules amusing. When I was a child in the Midwest, we went to school unless there was an absolute blizzard, an Arctic blast that brought temperatures so low that cars wouldn't start, or one time the school furnace failed. Why is school canceled today in Seattle? Well, under identical circumstances in Minneapolis, this would just be another Monday in February. The different conditions in the two cities explain the different school responses. Seattle has lots of hills. We have minimal snow removal equipment. We don't all have tires that perform well in the snow. The people who live in Seattle often have limited experience driving in the snow. If I applied the Minnesota snow rules to today's weather conditions in Seattle, I'd hop in the car and take my kids to school. I'd be surprised to find the schools closed and locked. If I applied the Seattle snow rules under identical circumstances in Minnesota, I would assume that school was canceled and keep my children home. This would result in an unexcused absence. You have to make sure that you understand how the local rules work. In a similar way, marketing to suits, business-minded prospects, is different than marketing to white coats. The biggest mistake financial advisors make as they enter the medical market is assuming that doctors will respond to the marketing messages that work well with business owners. this is simply not the case. Marketing to doctors follows neither the B2B nor B2C model. It's its own thing. I call it B2D, doing business with doctors. You enjoy success when you shift your language so that your message aligns with the kinds of conversations doctors are naturally having. Even if you've struggled in the past getting the attention of doctors, you might be closer to success than you think. It's simply a question of understanding how doctors think and network and make choices. So let's recap. The doctor market represents a massive opportunity for financial advisors. Doctors need specialized financial guidance, but most don't get it. Advisors who build trust and understand doctors' unique financial needs can create long-term, high-value relationships. So let me leave you with a question. If you could build a practice working with high-earning, intelligent, and referral-friendly clients, why wouldn't you go all out on serving doctors? If that interests you, here are some next steps. Subscribe to this podcast for more insider strategies on working with doctors. Go to Engaging Doctors and get on the mailing list to get regular updates about how to successfully acquire more doctor clients. And tune in for the next podcast episode, where I will lay out the 4 pillars for success in the medical market. And if you want to dive in today, check out my training about how and why to work with doctors in 2025. I'll leave a link in the show notes. Thank you so much for your time and attention. This is the right place and the right time to mine the treasures in the medical market. Stay tuned and I'll show you how.